The skin can reveal much more than meets the eye. In fact, certain changes in your skin can be an early indicator of serious underlying heart conditions. Here are 13 skin signs that could indicate serious heart problems. Number 1. Bluish or gray tint to the skin. Cyanosis occurs when your skin takes on a bluish or grayish hue, most commonly in the lips, fingertips, or toes. This happens when there's a lack of oxygen in the blood, which can result from serious cardiovascular problems. Conditions like congenital heart defects, heart failure, or chronic obstructive pulmonary disease, COPD, can impair the heart's ability to efficiently pump oxygenated blood. Cyanosis is often more noticeable during exertion or when exposed to cold temperatures, as the heart and lungs are unable to supply sufficient oxygen to the body's extremities. Number 2. Swollen legs, ankles, or feet. Swelling in the legs, ankles, or feet, known as edema, occurs when the heart is too weak to effectively pump blood. As a result, fluid builds up in the body's tissues, particularly in the lower extremities, where gravity plays a role in fluid accumulation. This can be one of the earliest signs of heart failure, especially if it occurs without obvious causes like injury or prolonged standing. Mild edema might initially present as a feeling of tightness in shoes or socks, leaving deeper impressions on the skin. Chronic or worsening swelling is concerning because it reflects ongoing stress on the cardiovascular system. In some cases, edema can also lead to skin infections or ulcers due to poor circulation. Number 3. Purple or red spots on the skin. Purple or red spots on the skin, known as purpura, occur when small blood vessels burst beneath the skin. This may happen due to an infection, vascular disease, or as a result of an underlying heart condition like endocarditis, an infection of the heart's inner lining. Purpura often appears in clusters and does not fade when pressed. This symptom can be alarming, especially if it develops suddenly and without injury, indicating that something more serious could be at play. Number 4. Waxy bumps. Xanthomas are yellowish, waxy bumps that can appear on the skin, often around the eyes, elbows, knees, or other joints. These bumps are deposits of cholesterol or fats and are a visible sign of high cholesterol levels, which are closely linked to heart disease. People with high cholesterol or triglyceride levels are more prone to xanthomas, and these bumps can be an indicator that cardiovascular disease may develop or is already present. Xanthomas are not just a cosmetic issue but a signal that your body is storing excessive fat in your skin. This buildup suggests that your arteries might also be accumulating fat, leading to a higher risk of heart attack or stroke. If you notice the development of these waxy bumps, it's important to get your cholesterol levels checked and take steps to manage your heart health through diet, exercise, and possibly medication to prevent further complications. Before we proceed to the next sign, be sure to hit the subscribe button. Number 5. Red lines under the fingernails. Splinter hemorrhages are thin, red or brown lines that run under the fingernails, resembling splinters. These lines are caused by small clots or damage to the blood vessels under the nails and can be a sign of a serious heart condition like endocarditis, where the heart's inner lining becomes infected. While trauma to the nails can sometimes cause similar streaks, when these lines appear without injury, they warrant further investigation as they may signal inflammation within the cardiovascular system. Splinter hemorrhages are a subtle but important clue that there might be a serious issue with your heart, particularly when accompanied by other symptoms like fever, fatigue, or unusual heart rhythms. If these lines appear, it's crucial to seek medical advice, as endocarditis and other cardiovascular diseases can lead to severe complications, including heart failure or stroke if left untreated. Number 6. Clubbing of the fingernails. Clubbing occurs when the tips of the fingers or toes become rounder and the nails curve downward. This change happens gradually and is often linked to chronic low levels of oxygen in the blood, which can result from serious heart or lung conditions. Clubbing is typically associated with conditions like congenital heart disease or long-term heart failure, where oxygenated blood is not being delivered efficiently to the extremities. If you notice that your fingernails or toenails have begun to change shape over time, particularly if combined with symptoms like shortness of breath or cyanosis, it's important to consult a healthcare provider. Clubbing is often one of the first physical signs of an underlying heart condition that requires treatment. Number 7. Cold or pale skin. When your skin feels consistently cold or has a pale appearance, especially in the extremities, it can be a sign of poor circulation, often linked to heart problems. This happens when the heart is unable to pump blood effectively, leaving the hands, feet, and sometimes the face or lips with insufficient blood flow. Cold skin can be an early warning of heart failure or other serious cardiovascular issues, particularly if you also experience symptoms like shortness of breath or fatigue. Number 8. Unexplained bruising. Frequent or unexplained bruising, particularly in areas that haven't sustained any obvious injury, can be a sign of poor circulation or a clotting issue related to heart health. When the heart struggles to pump blood efficiently, it can impact how blood is distributed and clot in the body. This can lead to easy bruising, even from minor bumps or without any noticeable trauma, and can signal more serious cardiovascular concerns, such as congestive heart failure. In addition to heart-related causes, unexplained bruising could also point to blood clotting disorders, which can increase the risk of stroke or other heart-related complications. Number 9. Slow healing wounds. When wounds or cuts on your skin take an unusually long time to heal, it may be a sign that your body is suffering from poor circulation, which is often linked to heart problems. When the heart struggles to pump blood effectively, it becomes difficult for oxygenated blood and nutrients to reach the site of an injury, slowing down the healing process. This can result in wounds, particularly on the legs and feet, that seem to linger for weeks or even months without improvement. In addition to being a sign of cardiovascular problems, slow healing wounds can also increase the risk of infection and other complications. Number 10. Rash or sores on the legs. Persistent rashes or sores on the legs may be a sign of poor circulation linked to heart disease. When the heart cannot effectively pump blood throughout the body, the skin, particularly in the lower extremities, doesn't receive enough oxygenated blood, making it more prone to damage. This can lead to rashes, open sores, or ulcers, which can be slow to heal and painful. Conditions like peripheral artery disease, PAD, are often behind these skin symptoms, as reduced blood flow restricts the body's ability to repair skin tissue. Number 11. Darkened skin patches. Darkened skin patches, also known as hyperpigmentation, particularly on the lower legs or feet, can be a sign of venous insufficiency, a condition where blood pools in the veins due to poor circulation. This can occur when the heart is not functioning efficiently, leading to the accumulation of blood in the extremities. The blood pooling under the skin causes a dark, discolored appearance, often accompanied by swelling or pain. Chronic venous insufficiency is often seen in patients with heart disease and should not be ignored. Number 12. Red moles. Cherry angiomas are small, bright red moles or spots that appear on the skin, caused by clusters of blood vessels growing near the surface. While these spots are generally benign, a sudden increase in their number or size could be associated with liver problems or heart issues, particularly in cases where the heart is under significant stress. Conditions like liver congestion, which is often linked to heart failure, can cause these spots to multiply. Although cherry angiomas are usually harmless, if they appear suddenly or are accompanied by other signs of cardiovascular distress, they may point to a more serious problem that needs to be investigated. Heart-related causes of cherry angiomas may also present with symptoms like fatigue, fluid retention, or jaundice. Consulting with a healthcare provider can help determine whether these red moles are linked to heart health or other underlying conditions. Number 13. Blue or purple, net-like pattern on the skin. Levato reticularis is a condition in which a blue or purple net-like pattern appears on the skin, typically on the legs or arms. This occurs when blood flow is sluggish and begins to pool in certain areas, often due to cardiovascular issues or blood vessel inflammation. This skin pattern tends to worsen in cold temperatures and can be a sign of poor circulation, which may be linked to heart disease, vascular conditions, or even autoimmune disorders affecting the cardiovascular system. In many cases, levato reticularis is harmless and resolves on its own, but persistent or severe cases should not be ignored, as they can indicate more serious problems like blocked arteries or heart failure. If you notice this pattern on your skin, especially if it comes with symptoms like swelling, fatigue, or pain in the affected areas, it's important to seek medical advice to rule out underlying cardiovascular issues that may need treatment. If you found this video helpful, please give it a thumbs up. Thank you for watching, and for more amazing videos, subscribe to our channel.